Have you had a stroke or any kind of injury to the brain? Are you having a hard time talking? Well, you might have aphasia. I'm Dr. Judy Gooch. I'm a rehabilitation doctor, and I work with people with aphasia. Aphasia is a problem with language. You can have difficulty speaking or difficulty understanding, or both. It can be mild or it can be severe. But at any rate, it makes communicating difficult. When you have aphasia, the problem is with communication, with language, not with thinking. People with aphasia may not be able to communicate well, but they can think well. Language skills are on the left side of the brain in most people. So injury to the frontal or the temporal lobes in the left side of the brain can cause aphasia. There are 3 types of aphasia. First, there's non-fluent aphasia, also called Broca's aphasia. People with non-fluent aphasia struggle to think of the word they want to say. They might say the wrong word, such as saying fish instead of chicken. They might use made-up words. They may speak in very short sentences or use single words. A person might say want food or walk park today. People with Broca's aphasia may understand what other people say better than they can speak. They're often aware of their difficulty and may get frustrated. Fluent aphasia is another type of aphasia. This is also called Wernike's aphasia. People with fluent aphasia have difficulty understanding language. They may speak easily in long, complex sentences that don't make sense. They might use incorrect words. And they might not realize that others can't understand them. Global aphasia is the third type. Global aphasia results from extensive damage to the brain's language networks. People with global aphasia have difficulties both with speaking and understanding. So how do you treat aphasia? There are many ways to work on your language if you have aphasia. Speech therapists can help people with aphasia. Treatment can be restorative, which means language skills get better or recover. Treatment can help compensate or make up for having difficulty talking and understanding. There are a bunch of different techniques to improve language. They might be computer-based, therapy-based, working with family, or using music. ASHA, or the American Speech and Hearing Association, has great information on treating aphasia. So what are some tips for communicating with a person who has aphasia? If I have aphasia, these are some things that can help. First, get my attention before you start speaking. Also, keep eye contact with me. Talk to me in a quiet place. Keep your voice at a normal level. You don't need to talk louder. Use simple words. Use shorter sentences and repeat keywords that you want me to understand. Slow down your speech a bit. Give me time to speak. It might take longer. Try using drawings or gestures or expressions. Ask me simple yes/no questions. Those are often easier to understand. And last, let me make mistakes sometimes. I might not be able to say everything perfectly all the time.